Think about your body as a finely tuned machine. Everything needs to be in just the right proportion, right, to run smoothly.
Mm-hmm.
Today, we're diving into a situation where even like a slight increase in the concentration of certain particles in your bloodstream
Mm-hmm.
can throw things off in pretty surprising ways.
Yeah, we're talking about hyperosmolarity.
Hyperosmolarity, okay.
Exactly. At its core, it's simply a state of higher than normal concentration of solute particles, things like sodium, for example, in the liquid part of your blood.
Right.
We've been looking at understanding hyperosmolarity in animals to really, get to grips with what this is, what can trigger it, the key signs to be aware of,
Okay.
and a really critical factor, how quickly this change happens. Our goal today is really to give you a clear picture of this complex process without hopefully getting lost in overly complicated science.
Okay, so let's try and break down some of the basics then. We hear terms like osmolarity and osmolality thrown around.
Right, they sound similar.
Yeah, they both describe concentration,
Mm.
but osmolarity looks at the number of particles per liter of solution,
Mm-hmm.
whereas osmolality is particles per kilogram of solution.
Mm.
So hyperosmolarity specifically refers to that high concentration per liter of your blood.
That's a good way to put it. Yeah, per liter solution. And for some context, this particular text gives us some specific numbers that are kind of the thresholds in animals.
Okay, like what?
So for dogs, if the concentration goes above about 310 million noles per liter, or osmol, that's generally the point where we'd consider it hyperosmolar.
310 for dogs.
Yep. And in cats, it's a bit higher, usually above 330 osmolari. But, and this is a really key insight here, something the text really emphasizes.
What's that?
It's that the danger often lies more in how fast these levels change rather than just how high they ultimately get.
The rate of change.
Exactly. Think of it like a sudden shock to the system versus, a more gradual adjustment. The body can sometimes cope better if it has time.
That makes a lot of sense. So, okay, what's the underlying mechanism here? What's actually causing this high concentration of particles in the blood?
Well, as our source points out, the amount of sodium in your blood is a major player. It really drives the overall concentration.
Sodium, right.
But things like glucose, blood sugar, and urea, waste products, they also contribute. Essentially, if the body loses water, the concentration of these particles that are left behind naturally goes up. It's like, imagine a glass of salty water. If some water evaporates, the water left is much saltier.
Right, okay, so dehydration is a pretty significant factor then.
Absolutely. Your body has this really sophisticated system for regulating fluid balance. It involves blood volume, how hydrated you are overall, and a hormone called antidiuretic hormone, ADH.
ADH, okay.
So if your blood volume drops, maybe from dehydration, sensors in your body detect this, and that triggers the release of ADH.
And what does ADH do then in response?
ADH basically tells your kidneys to hold on to water, so you produce less urine, trying to conserve fluid.
Makes sense.
Now, the state of high concentration itself, the hyperosmolarity, that also sets off a chain of events. It affects specialized cells in a part of your brain called the hypothalamus.
Ah, the hypothalamus.
Yep. Which then also signals for more ADH release. And interestingly, this same area of the hypothalamus also controls your thirst.
Oh.
So when your blood becomes too concentrated, you feel thirsty. That prompts you to drink, hopefully, and dilute those solutes back down.
Okay, so the body definitely has ways to try and fix this imbalance. But you mentioned, and the source did too, that rapid increases in this concentration can be really dangerous. Why is that? What happens?
Yeah, this is where that speed of change becomes so critical. When the concentration in your blood rises quickly, water basically gets pulled out of your cells.
Out of the cells.
Yeah, including the cells in your brain. Water moves into the surrounding fluid to try and balance out the concentration.
Okay.
But this rapid loss of water from inside the brain cells causes them to dehydrate and actually shrink. And in really severe situations, it can even lead to cell damage.
Wow.
The blood vessels in the brain can also become vulnerable. This is exactly why a gradual increase in concentration, even if it gets quite high, is generally tolerated better than a sudden sharp jump.
That paints a really vivid picture of what's happening inside. So, okay, what are some of the outward signs then? What might indicate hyperosmolarity? What body systems start to show the effects?
Well, the source material highlights a few key areas. The cardiovascular system can be affected, potentially leading to low blood pressure,
Hypotension?
right? Hypotension, and maybe a reduced ability of the heart muscle to contract effectively. Neurologically, one of the initial clues might just be excessive thirst, as the body tries to get you to drink more.
The thirst mechanism kicking in.
Exactly. But if the hyperosmolarity develops quickly or gets really severe, it can lead to a slowing down of the central nervous system. You might see sluggishness, lethargy,
Okay.
potentially even progressing to a comatose state in the worst cases. Kidney function can also be affected, often resulting in reduced urine production as the body desperately tries to conserve water.
So we're primarily looking at changes in behavior, maybe thirst, and potentially some physical indicators related to hydration, blood pressure, maybe urine output.
That's a good summary, yeah.
Now, this research focuses on animals, specifically dogs and cats. Are there any particular groups within these animals that might be more susceptible? Any predispositions?
Yes, actually, the text includes a really interesting specific finding. It mentions that a reduced sense of thirst, the technical term is hyperdipsia,
Hypodipsia.
along with hyperosmolarity, has been specifically observed in young female miniature schnauzers.
Miniature schnauzers. That's very specific.
It is. It's just one example that shows how certain breeds or maybe demographics might have particular predispositions we need to be aware of.
That's a surprising detail.
Mm.
So, okay, if someone suspects hyperosmolarity in their pet, maybe they have a mini schnauzer or just notice some signs, what are some of the things they might have observed? Or what might a vet see during an examination that would raise a red flag?
The source generally points to neurological or behavioral changes as the primary indicators. And again, it really stresses that how quickly these changes come on is a big factor in how severe they might seem or be.
Right, the speed again.
Although concerns generally increase when the concentration goes above, say, 350 bilirubin, and it's usually pretty serious above 375.
Okay.
So historically, what owners might report, things like their pet being off their food, anorexia, being very tired, lethargic, maybe vomiting, seeming weak, disoriented.
Disoriented, yeah.
Even having an unsteady gait, like stumbling, which is ataxia, experiencing seizures, or even being unresponsive, like in a coma.
That's a scary list.
It is. And interestingly, there might be a history of the animal initially drinking a lot more water, which then paradoxically decreases. They stop wanting to drink.
Oh, wow. That shift from increased thirst to decreased thirst sounds like a really important warning sign.
It certainly can be, yeah. And then on a physical exam, what the vet finds can vary quite a bit. In mild cases, or ones that develop slowly, everything might actually seem pretty normal. But along with those historical signs we just talked about, a vet might observe signs of dehydration, like tacky gums or skin tinting, or rapid heartbeat, tachycardia, low blood pressure, hypotension, weak pulses, and potentially even a fever.
Okay, so we've got a better handle on what hyperosmolarity is, who it might affect, and the signs. Let's dig a bit deeper now into the why. Looking at the specific triggers, what are the root causes here?
Yeah, the source helpfully categorizes these into two main buckets, sort of. Situations where there's an increased solute load.
More stuff dissolved in the blood.
Exactly, and those with decreased extracellular fluid volume. Basically not enough fluid.
Gotcha. So under increased solutes, what are the big ones?
Well, a major one is hypernatremia, simply high levels of sodium in the blood.
High sodium?
Hyperglycemia or high blood sugar, especially in uncontrolled diabetes, that can also significantly increase the concentration.
Right, the sugar acts like a solute too.
It does. Then there's severe azotemia, which is basically a buildup of waste products in the blood because the kidneys aren't filtering properly.
Kidney issues.
And certain toxins are big culprits. Ethylene glycol, that's the main ingredient in antifreeze.
Oh, yeah, that's really dangerous.
Extremely. And also just excessive salt intake, like salt poisoning.
And I think I remember reading something at the source about enemas being a risk.
Yes, that's a really crucial point to highlight, actually. The text specifically calls out sodium phosphate enemas.
Okay.
Particularly if they're given to cats or maybe small dogs, they can lead to a really dangerous spike in sodium and consequently hyperosmolarity.
Good to know. Wow.
And there are also some medical treatments that can, inadvertently contribute. Mannitol, which is sometimes used to reduce swelling in the brain.
Right.
And the contrast solutions used in some types of medical imaging, like CT scans or MRIs, those can both increase the concentration in the blood.
So even medical interventions can be a cause.
Sometimes, yes. Less commonly, things like alcohol consumption or aspirin poisoning can play a role. Even conditions like shock or lactic acidosis, ketoacidosis, and the administration of liquid food through tubes or IV, that parenteral or enteral nutrition can sometimes lead to higher solute levels.
Okay, that's quite a range of potential causes linked to increased solutes. What about the other side, decreased extracellular fluid volume?
This is primarily driven by dehydration, as we touched on.
Right.
And dehydration can happen for all sorts of reasons. Significant fluid loss through vomiting and diarrhea, maybe excessive loss through the skin, although that's less common in typical pets than, say, humans sweating.
Sure.
What's sometimes called third space loss, where fluid moves out of the bloodstream into other body compartments, like the abdomen, simply not drinking enough water, or excessive urination, polyuria, without drinking enough to replace those lost fluids, like you might see with kidney disease or diabetes.
So it really sounds like many, many different pathways can lead to this one specific imbalance. Who then would be considered at a higher risk of developing hyperosmolarity?
Yeah, the source outlines several risk factors. Certain underlying health conditions definitely make animals more susceptible.
Like what?
Things like kidney failure, diabetes insipidus, that's a problem with regulating water balance, not the same as sugar diabetes.
Right, the water one.
Diabetes mellitus, the sugar one. Hyperadrenocorticism, like Cushing's disease. Hyperaldosteronism. And even heat stroke.
Heat stroke, okay.
And we also need to remember those medical treatments we just discussed that can increase solute levels, things like hypertonic saline, sodium bicarbonate, those sodium phosphate enemas again.
Right, circling back to those.
Mannitol and parenteral nutrition. And finally, environmental factors can play a role too, like high environmental temperatures and fever can also increase the risk, mainly because they contribute to dehydration.
This really underscores how delicate the body's fluid balance actually is. So, if a vet suspects hyperosmolarity, how do they go about diagnosing it? What's the sort of diagnostic process look like?
The source highlights several key steps. First, when they're thinking about what else could be going on, the differential diagnosis.
Ruling things out.
Exactly. It's important to consider other conditions that might cause similar signs, especially those neurological changes like lethargy or disorientation. For instance, primary problems within the central nervous system, maybe inflammation or even a tumor, could alter mental state, but usually in those cases, the blood concentration, the osmolarity, would be normal.
Okay, so that's a key difference.
It can be. And, asking about any history of physical injury can usually help rule out trauma to the brain as a cause of depression. A thorough physical exam is obviously essential to assess how hydrated the animal is.
Check the gums, skin.
Right. And it's really important to find out about any recent treatments that might have involved fluids containing sodium or other substances that could, increase concentration.
Gathering that history. And what about lab tests? Blood work, urine samples. What can they tell us?
Oh, lab results are hugely informative here. As we've discussed, certain treatments involving sodium or other high concentration fluids will directly increase the measured concentration in the blood. That's pretty straightforward.
Yeah.
In a dehydrated animal, blood tests like a CBC or chemistry panel might show a higher percentage of red blood cells, maybe higher hemoglobin, higher protein in the plasma, just because the fluid component is lower.
Everything's more concentrated.
Exactly. The levels of electrolytes, including sodium, might also be elevated. And the source really emphasizes that if hyperosmolarity is suspected, it's crucial to specifically measure the sodium and glucose levels in the blood. Those are key players.
And isn't there a formula mentioned for actually calculating what the concentration should be based on those values?
Yes, exactly. There's a standard formula. It's basically 2 times the sum of the sodium and potassium levels,
Okay.
plus the glucose level divided by 18, plus the BUN level, that's blood urea and nitrogen, divided by 2.8. This gives you an estimate of the osmolarity in milliosmoles per liter.
So you calculate that number.
Right,
Yeah.
and normally this calculated value should be pretty close to the value that's directly measured by the lab machine.
Okay.
Now, if the measured level is significantly higher than what you calculated, it suggests there are other things, other solutes in the blood that are contributing to the high concentration but aren't included in that standard formula.
Unmeasured stuff.
Precisely. And that difference between the measured and the calculated value is what we call the osmolar gap.
So a big osmolar gap gives you a clue that something else might be going on, like maybe a toxin.
Exactly. A high measured concentration with a calculated value that's not nearly as high, meaning a large osmolar gap, really points towards the presence of these unmeasured solutes. On the other hand, if both the measured and the calculated values are high and the gap is normal, it usually means the high concentration is primarily due to elevated glucose or sodium, the things included in the calculation.
Got it.
The source also notes a kind of tricky point. In cases of very, very high blood sugar, the measured sodium level might actually appear falsely low on some lab tests, which can complicate the picture a bit.
Oh, okay. That's an important detail for interpretation.
Yeah.
What about looking at the urine? Can urinalysis provide clues?
Absolutely. Urinalysis can offer really valuable information. For example, if you find high glucose in the urine along with high blood sugar, especially if the animal hasn't eaten recently, that strongly suggests diabetes mellitus. The presence of specific types of crystals in the urine can also point towards certain toxins, like those calcium oxalate crystals are often seen with ethylene glycol, antifreeze, poisoning.
Ah, specific markers.
Yes. And the concentration of the urine itself, which is measured as urine-specific gravity, can also be helpful. Very concentrated urine generally makes diabetes insipidus unlikely. Whereas very dilute urine, especially if it's more dilute than the blood, what we call hyposthenuria, is suggestive of diabetes insipidus.
So concentrated versus dilute urine points in different directions.
Right. And similarly, if the measured concentration, the osmolarity of the urine is lower than the osmolarity of the blood, that supports a diagnosis of diabetes insipidus. If the urine is more concentrated than the blood, that makes diabetes insipidus much less likely.
Okay. Any other tests?
Well, in some specific situations, like if ethylene glycol poisoning is strongly suspected, ultrasound imaging of the kidneys might reveal characteristic changes, like the kidneys appearing unusually bright on the ultrasound.
So it's really a combination then looking at the animal's history, the physical exam findings, definitely blood and urine tests, and sometimes imaging, all helping to piece together the puzzle.
That's exactly right. It's about putting all those pieces together.
Now let's talk about treatment. Once hyperosmolarity is diagnosed, how is it managed? What's the approach?
Well, the way we approach treatment really depends on how high the concentration actually is, and importantly, whether the animal is showing clinical signs.
Right, the symptoms.
So mild cases where the concentration is only slightly elevated and the animal seems okay might not need specific treatment directed at the hyperosmolarity itself. But it's absolutely crucial to identify and treat whatever underlying cause led to it.
Address the root problem.
Always. However, if the concentration is moderately to severely high, let's say typically above 350 Maros SML, or if the patient is showing neurological or other clinical signs, then hospitalization and a careful, gradual lowering of the blood concentration using intravenous or IV fluids are usually necessary. And again, that's alongside working to figure out and treat the root cause.
Okay, hospitalization and IV fluids. And what kind of fluids are typically used in these situations?
The source mentions that treatment often starts with fluids like D5W, which is a 5% glucose solution in water, or maybe a 0.45% saline solution that's half-strength saline.
More dilute fluids.
Generally, yes, to help lower the concentration. And these are given slowly through an IV. There's also a formula that vets can use to estimate how much extra water the body needs, what's called the free water deficit. This helps guide how much fluid needs to be replaced over time.
That helps calculate the amount. But the source really seemed to emphasize the importance of not correcting the sodium levels too quickly, right? That sounded critical.
Absolutely. This is probably one of the most critical aspects of treatment. The goal is to not reduce the sodium concentration by more than about 15 milliequivalents per liter, MEQL, over an 8-hour period.
Okay, 15 in 8 hours.
And ideally, no more than maybe 2 MEQL per hour on average. Lowering the sodium level too rapidly can lead to really serious complications, particularly swelling in the brain, which is called cerebral edema.
Brain swelling. Yeah, that sounds bad.
It is. So the approach is often staged. Initially, a more balanced fluid like standard 0.9% saline might be used just to help restore blood flow and address immediate dehydration or shock.
Stabilize first.
Exactly. The source suggests maybe replacing about half of the estimated overall fluid deficit in the first 12 hours or so, and then the rest over the following 24 hours. Then, once the patient is more stable, they might switch to those more dilute or hypotonic fluids like D5W or 0.45% saline to specifically address that free water deficit and slowly bring the concentration down.
That makes sense. Stabilize, then carefully correct the underlying imbalance. Are there any specific medications that might be needed during this treatment?
Yes, potentially. If the animal is having seizures as a result of the hyperosmolarity,
Right, you mentioned seizures earlier.
then medications like diazepam, maybe phenobarbital, propofol, or pentobarbital might be used to try and get those under control.
Okay.
The source also points out some important things to avoid. Hypertonic saline, that's very concentrated saline, and other solutions with a very high concentration of solutes should generally not be used in this situation, as they'd make it worse.
Right, counterproductive.
Definitely. And while normal saline, that 0.9%, can be used initially for stabilization, giving it too quickly might actually worsen the neurological signs in some cases. And similarly, giving those dilute hypotonic fluids too rapidly can also cause problems, potentially leading to that brain swelling we mentioned and worsening neurological symptoms. It's all about careful, gradual correction.
So slow and steady is the key.
Very much so. There's one other specific medication mentioned. In cases where the high blood sugar is due to intravenous feeding, that parenteral nutrition,
I
then regular insulin might be administered carefully to help lower the glucose levels and thus the osmolarity.
Okay. And what kind of monitoring is important while the animal is receiving all this treatment? What are vets looking out for?
Close and careful monitoring is absolutely essential throughout. This includes regularly checking the animal's hydration status, making sure they're getting enough fluid, but also being careful not to give too much fluid, which can also cause problems.
Right, finding that balance.
Exactly. Keeping track of urine production is really important for assessing kidney function and whether the fluid therapy is working. Breathing patterns should also be monitored closely during fluid therapy.
Okay.
The source lists some concerning signs that would indicate the patient might be getting worse. Things like a lack of urination, developing irregular breathing patterns, becoming increasingly sluggish or unresponsive.
Worsening neurological signs.
Yes, or having recurring seizures despite treatment. Changes in consciousness or any abnormal behavior are also potential complications that everyone needs to watch for very carefully.
This has been a really, really comprehensive look into hyperosmolarity. So just to quickly recap the key takeaways. It's essentially about a higher than normal concentration of particles, like sodium and glucose, in the blood. And the speed at which this change occurs is often more critical, more dangerous than the absolute level it reaches.
That's a crucial point, yes.
And we've learned it can be triggered by a whole range of factors. Dehydration is a big one, but also underlying health issues like kidney disease or diabetes, certain toxins, and even some medical treatments.
A really wide net of causes.
Recognizing the signs, which often involve neurological or behavioral changes like lethargy, disorientation, or that shift in thirst, and then using a combination of the physical exam and those lab tests, blood and urine, are key to getting the right diagnosis and starting the right treatment.
Absolutely. And the cornerstone of that treatment, as we discussed, is that careful, gradual correction of the fluid and electrolyte imbalances, usually with IV fluids, all while closely monitoring the patient for any improvement or potentially complications.
So stepping back for just a moment and thinking about the bigger picture here, we spent this time talking about how many factors can influence this really delicate balance of fluids and solutes, specifically in animals.
It's complex.
It really makes you wonder about our own bodies, doesn't it? I mean, what are some everyday scenarios in human health where subtle shifts in our internal environment might be occurring? And, why is having even a basic understanding of these fundamental mechanisms potentially so important for maintaining our own overall well-being?
That's a great question to ponder. It really highlights the incredible complexity and the constant balancing act that's happening inside all living things all the time.